these things run. So the challenge and the opportunity of being the last speaker following 3 great presentations is it gives me an opportunity to be brief. So I'm going to try to be quick. I know your heads are full of a lot of things, so I'll try to be quick and out of here. The other challenge with this, is this on?
Yes.
All right. Okay, sorry. Am I loud? Sorry. So the other challenge was trying to find something novel to talk about. I figured I'd look at value from the consumer angle. Amanda did touch on that. I might agree and disagree with some of what she said. That might give us also room for some questions to ask. So in terms of being simple, I actually think there's a lot of parallels. A lot of people have spoken about this. A lot of parallels between banking and healthcare in terms of how the industries have evolved. Right now, if you just look at retail banking or consumer banking, you have choices of where to go. And there is no idea of what's the most valuable thing. There isn't an absolute answer to this. You allow people to have a choice, make a decision on where do they want to go. What's the places that's nearest? What are the services that I need? What types of benefits do they offer me? And we have to take that same, there's an opportunity to take that same mentality into healthcare. I will acknowledge that there's some people that say that the idea of the healthcare consumer is a bad phraseology because a lot of healthcare users don't have a choice. They don't have all the angles of consumerism. There is a segment of the population that does have an opportunity to make choices, and I think that's a segment that's actually maybe more accessible to entrepreneurs, because a lot of what we talked about is with policy, and it's really hard to impact policy as an entrepreneur. So what are the opportunities for consumerism and healthcare? What are the factors driving this? One, patient or user, healthcare user, inputs are becoming more important. People are becoming more vocal. So hospitals payments are based on consumer satisfaction, patient satisfaction. Also, as consumers, we're used to being able to get things on demand. People talk about the Uberization or the instification of a range of services. People are starting to have higher expectations of their healthcare. People are demanding more from their services. Healthcare is no longer a sacred cow. People do have choice. Again, a segment of people do have choice. They can choose which healthcare system that they want to go to, how they get their healthcare delivered. Again, this offers an opportunity for healthcare for companies to come in and offer differentiated services. And the biggest thing that's impacting consumerization of healthcare, in my opinion, is cost. One, healthcare costs overall are going up, and then the newest 4-letter word, in my opinion, is HTHP. Anyone know what HTHP stands for? Right, we've got an educated crowd here, which is great. It's the high deductible health plan. So if you roll back the clock 20 years, what does the consumer care where I go? I go somewhere, I pay $100 or I pay $1,000 a year. That's essentially what I pay. Now, if I go in to go see a service, I pay 100% up to the first $10,000 perhaps. So, and even after that, I have to pay a certain amount. So now it really does affect me in the pocketbook. And a lot of the self-insured employers, a lot of the employers overall are moving to a model like this. And so now the healthcare user is becoming more involved in their healthcare choices. So as technologists, what are again, being simple, what are the 2 trends that are enabling consumerization? One is information, letting people understand what the options are, what the choices are, what their health is. So gross generalizations here, but wearables, things that put your information in your hands so you know what your state is at any point in time. There are assistants that are actually paid on top of healthcare systems to help you figure out choices. And now you have choices on delivery. You can pick where you want to go, how you want your services delivered, and you could say, is CrowdMed a delivery system? It's a way for you to get information, be able to get those first stages of treatment that you don't have to go in to see your primary physician for, perhaps. My tiny bit of individual perspective on this. So I run a product at a price transparency company. And unfortunately, I lost an argument a few minutes before this meeting with my team. I was not allowed to show data. I know we're all data folks, so these are anecdotes extrapolating from that data. So I apologize, I can talk about the data offline, but not in a public forum. But so what we found, when consumers are armed with choice, showing both quality and cost, they won't go for the low cost options, even if it's, they won't go for the low quality options, even if it is at a low cost. But just the same, if the high cost option is significantly higher than something that's 5-star versus 4-star, that those options, the high cost, the high quality, high cost options don't get selected either at an even lower rate. And then as you look at people who have chronic conditions, so these are people who get the same services month over month, or need the same types of treatment, need the same kind of medicine, when they're armed with information, they will make changes. We said across a range of, again, we're with self-insured employers, so there's some selection bias there. But we're seeing, we do service both white collar and blue collar employees, and we see that across the board, people who have chronic conditions, armed with choices, they will make changes that reduce their costs, reduce the company's costs, and the idea is that that's an improvement in overall delivery of value. And that's it. I wanted to leave you guys time to ask us all questions. So
yeah, we probably have about 5 minutes if you want to ask any questions to either Jonathan or even Shahid, or is Amanda here? Yeah, okay, or Amanda. So it's a public forum right now, so we're just gonna see if you have any